Hi everyone, I'm Hripco. For my project, I explored health insurance disparities among Asian American women. This topic is deeply connected to oppression through what Sonia Renee Taylor calls body shame profit complex, a system where industries, including insurance, often profit from designing guidelines that cater to a privileged default while financially penalizing or marginalizing minority bodies. To understand the data and the lived experience, I researched two peer-reviewed studies. First one is on breast cancer screening among Korean American women. The researchers surveyed 196 Korean American women to figure out why this specific demographic has historically lower breast cancer screening rates compared to other racial groups. Here's what the data revealed. An overwhelming majority of the women surveyed, 93% actually had health insurance. However, having insurance did not equate to actually getting preventive care. The reason is over half of the participants, 54%, reported experiencing perceived discrimination when trying to navigate the healthcare system. Discrimination actively destroys a patient's trust in their healthcare providers, and once that trust is broken, the women are far less likely to utilize their health insurance benefits for vital screenings. And Sonia Renee Taylor argues that oppressive systems are upheld by the way we treat bodies that fall outside the privileged default. And when these 54% Korean American women experience discrimination, they are experiencing systemic bias against their specific intersection of race, gender, and perhaps language. The system alienates them, breaks their trust, and effectively pushes them out of the preventive care loop. If women cannot trust the formal medical establishment because of discrimination, where do they go? This perfectly ties into our second article, how patients with limited English proficiency make healthcare decisions. Hmong patients' perspectives. They conducted semi-structured interviews through which it was revealed that Hmong patients often relied on bilingual family members to navigate medical hurdles instead of turning to their medical providers. And community care evolved to fill the gaps left by formal systems, which is interesting. And all of this ties together into discrimination and why they do that. The takeaway is that informal support networks become a safety net when systems fail. Um, this is very important because all of this is based on all of these reasons are because of the system that needs to change. And for the self and community care action, I decided to do a 2 week daily self-care practice, a 15-minute daily tea ritual, which was inspired by my Slavic heritage, a practice that I abandoned a long time ago, but I came back to it for this project. And I was inspired by Sonia Renee Taylor's ideas about the fact that our lack of intervention is an act of maintenance. And the three things I learned through doing this daily ritual is that reclaiming time is a form of de-indoctrination from systems that monetize our energy. Because I had to actively resist an internalized pressure to stay busy all the time. And this gave me a time to pause and just reflect. And I realized that these private rituals of care can build the resilience needed for future systemic change. And I definitely recommend something like this. It's definitely a good meditative practice as well. For the reflection, I realized that as a business finance major, I usually think about insurance as numbers, risk, and efficiency. But this project pushed me to see insurance as a lived system of equity and exclusion. And the studies, they just made me feel more human about these problems rather than something abstract. The challenge that I encountered during this project is finding truly scholarly sources that are peer-reviewed. And the way I overcame it is just I refined my State1 search strategy to find the studies I needed. And luckily, I found the studies I needed. And I'm glad how this project turned out. Very proud of it. Learned a lot through it. Thank you so much for listening, and have a great rest of your day.